Today we're going to be reviewing a video based around LDL cholesterol, which inherently is known as bad cholesterol, but for anyone who's watched any of my stuff before and understands that cholesterol is just the same, there's no such thing as good or bad, it's just how it moves around in the body. Now this one was given to me, so I have no selection bias. It was a trending video, so it's done by a Nick, who I think is a medical doctor in America, but again, the title is LDL 400 and no heart disease. So we'll get into it and see what they have to say on it.
My mother, who's an MD PhD like me, has an LDL cholesterol level around 400 milligrams per deciliter. That is...
So in America, they tend to use milligrams per deciliter, where in the UK, we use millimoles per litre. Now, off the top of my head, I think 1 millimole per litre is equivalent to about 38 milligrams per deciliter. So regardless, this is very high because an LDL within the UK, we aim for less than 3 millimoles per litre. That is where we would like it to be. Obviously, if you've had a heart attack or stroke, we go for lower reference ranges, less than 2, even 1.8 millimoles per litre, if we can.
Astronomical. She just turned 60, and guess what? She has 0 arterial plaque as confirmed by CT angiography. That's not a flex. It's a fact. It's a provocative fact, yes, but still a fact. And I share it to highlight one of the most controversial, yet least controversial, truths in cardiology. High LDL cholesterol and ApoB are not sufficient to cause cardiovascular disease or atherosclerosis. That doesn't mean they aren't risk factors. That doesn't mean they don't matter. But like all biomarkers, they must be interpreted in context.
That's the main thing, is that, so ApoB is a greater measure of atherogenicity, which is the ability to cause plaque within coronary arteries. And I think from what I've read, from what I've seen personally within my clinics, I think it's hard to say that having a lower ApoB is more beneficial for your cardiac health. I think we all agree, or a lot of people agree on that. There's a lot of people that do have this cholesterol myth, which I still don't really understand. Some of the reason that was given forward to me the other day was the fact that because you're older, your cholesterol is meant to be higher. I think that's just more of a correlation. As you do get older, your cholesterol will get higher. Numerous things that contribute to that are a lack of clearance from the liver. Food and diet normally goes out the window, so saturated fat normally goes up, exercise normally goes down. So all these factors predispose to that, but it doesn't mean it's right. Same way, it's, in my opinion, it's like saying when you get older, you're allowed to move less. Not necessarily, it's just a correlation. People just don't tend to move as much when they get older. But if you look at these certain populations where it's in Sicily, Okinawa, for example, they're highly active into the 8th, 9th decade. So that's what we should be doing. But because it's happening doesn't mean it's right. But going into this, so blood results, and a lot of people who take or give health advice online usually give advice in isolation. So the idea that ApoB and LDL alone cannot cause, or don't necessarily cause atherosclerosis is true, because it's merely the same as if you think about having a seatbelt. Wearing a seatbelt does not prevent you from having any fatalities in a car crash, but we still do it anyway because it lowers the risk, and it's the same with this. I'm not sure what he's going to go on to say, but I'm pretty sure it will be along the lines of inflammation, other risk factors, and when you amalgamate them all together, then your risk is disproportionate. It goes through the roof.
Context that includes a person's metabolic health, family and personal history, and potential risks of particular treatments. Bottom line, treat the individual, not the isolated marker. That shouldn't be controversial.
Next video is about LPA, which is something that I've got a genetic predisposition in. But going back to that, you do need to treat the individual. Like I said, it doesn't mean that one metric being out of range for one person means that everything's going to go against them. But I think it's important to not neglect it. We have to do a holistic review of all blood results, all family histories, metabolic history, everything that you can think of to build up your overview and give you greater insights is always going to be more beneficial for your health. Yes, ideally optimize things in isolation if you can, but you've got to look at the bigger picture. For example, having an LDL, so mine actually was 3.7, which in American terms is probably around 150 milligrams per deciliter. Either way, with my LPA being through the roof, so mine's greater than 240 nanomoles, straight away I know I'm at high risk there. So can I mitigate my risk in other ways? So metabolically, I've got a genetic form of diabetes, again, another risk factor, so adding it up to this side. I need to try and mitigate it in other areas. So the way I do that is try and increase the amount of lean mass I've got. I try and improve the amount of aerobic training that I do to make my body utilize energy sources and fuels in a different way, more efficiently, shall we say. But because I've got this, doesn't mean I will go on to have a heart attack. Based on my family history, everyone's had a heart attack before the age of 50 on my dad's side, definitely in the males. Females as well have had a stroke before the age of 70. So all these things have compounded against me, whereas if you took my blood results outside of all them other factors and applied it to someone else, it may give them a different risk profile. Biggest thing about this video, don't take results out of context, don't isolate them in any way, shape or form, and also don't let it bring along anything to do with health anxiety. You should use this to better improve your health. It shouldn't be debilitating your health going forward. You shouldn't be crippled by these results. And I think that's the biggest take home, is work towards what you can and just take more accountability of your health. And as always, if you've got this far, thanks for watching, and I'll see you in the next video.